this is not going to herniate further and I'm going to get over this. I trained for this. This is why I tell you guys, strength training is non-negotiable. There is no way. So today, right now, my pain is down by 85, 90% from where I was on Tuesday. And the only reason for that is because I came into it prepared. I took care of a lot of women and men in my age cohort. I was in my 30s and 40s when I was taking care of these patients, but most of them were complete disasters of health. And your tissues quite literally start melting off of you in middle age if you haven't been taking good care of them. If you've not been nutritionally dense, if you've been smoking, drinking a lot, not working out, you're just literally one bad step away from everything just ripping apart. I'm not exaggerating. I would put my hands on these women, especially because now their hormones are dumping out. So they're losing all their hormones concurrently. They very, very rarely had good muscle mass, right? And they would come in and say, well, can't you fix my knee, or can't you fix my shoulder, or can't you fix my back? And I'm like, your tissues are melting off of your body. There's so much more we need to do here besides just injecting the tissues, right? It's not going to hold. It's like trying to put out a fire with a fire extinguisher while somebody's continuing to pour lighter fluid and burn down the house, right? And so it's just not a great idea. Plus, if everything's inflamed and hormonally unoptimized and deconditioned, and there's no, like, your muscles get fatty infiltrate when you have metabolic dysfunction, and they get fatty infiltrate when they're not being used. The spinal muscles, the little tiny stabilizers of the spine, get fatty. They literally get fatty infiltrate in them and they atrophy. So most people are walking around with these really fatty, weak spinal muscles. That's not even accounting for the core muscles and the corset, the muscles that like pull you together from the top through the diaphragm, through the abdominal corset muscles down into the pelvic bowl, and those pelvic floor muscles. Those are so weak and blown out in most people that they have no control over their core. And I was like, no, I've been doing a ton of Pilates. I've been strength training for years. I got this. And I used to do a ton of Pilates. I had taken some years off and I've come back to it. So I had the muscle memory. So like I have literally for over a decade been training to handle this. And I was determined to get through it. And I knew I would because I came into it so fit. And that was the number one thing. I eat well, I get enough protein, I take good care of myself. But more importantly, I came into it fit. And this is why we train. Hear me right now. If you have been one of those people, I get messages from you all the time. You know who you are. Dr. Tyna, I'm on GLP-1s. Or Dr. Tyna, I'm doing all the things you tell me and I've lost so much weight. Or Dr. Tyna, I switched all my diet up and I got off of the Dr. Pepper and I'm eating more protein and it's been miraculous. And then the next thing everyone says to me, and you've heard me bitch about this before, but I haven't started strength training yet. And I'm like, what? That's the first thing you're supposed to do. That's literally step one. I don't care if you're eating like complete garbage and you're drinking all the Diet Coke in the world. Start with strength training. Everything else will improve itself. I promise. You have to strength train. You middle-aged ladies and you men, you have to strength train. Like men, especially, like my husband, blue collar guy, right? He's very physical with his work, but I've seen so many guys in that construction world zone where they're like, I work with my body every day. I don't need to work out. I'm like, you are literally one twisting and bending move away from a disc herniation. And here I am experiencing it myself. And I'll tell you why. I've had a series of unfortunate events the past few years when it came to musculoskeletal orthopedic injuries. And it's because my estrogen dumped out quickly. It all happened around the same time, 2021. I started going into perimenopause pretty aggressively due to the stress. The stress exacerbated it. COVID exacerbated it. And then I ended up in that sort of like low hormone state. And I've been pulling myself out of the pit ever since. So I do supplement. I don't even know why I went off hormones for a couple of years, which is a totally stupid idea. But anyway, I'm back on everything. I feel much, much better for it. I look better when people are like, oh, you look great. Is it your hair? And I'm like, yes. And I went back on hormones and I'm taking a little bit of GLP-1, which is doing awesome things for my immune system. So I had everything on board and I was prepared. I'm not bragging. I'm telling you this as a warning. Please, you guys, I've taken care of so many patients exactly like me who weren't prepared. They didn't come into it well-fed, well-trained, and prepared. And it was a disaster. I guarantee if this had happened to me and I was not in the shape I'm in and I was not eating well and I was not living the way I'm living, this would have been a surgical emergency. I know it. It would have been so much more severe, but my body held me together. And my tissues were strong and the ligaments supporting the posterior of my spine and anterior were strong. these become very compromised. The people who herniate discs are your smokers, your people who eat really crappy food, who are severely deconditioned. So their tissues are garbage because there's no good nutrition in them. And it's been going on this way often for decades. And then they're not trained at all. They're not in good shape. They're not conditioned. So they have no control over their spinal movements. Their spine is just like they're sort of flopping in the wind, you guys. These are the women that go to pick up something and like their whole shoulder goes into lockdown because frozen shoulder is a hormonal issue, but it's also a deconditioned issue.